Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today. In this episode, I will discuss the DANPACE II trial, atrial pacing minimization in sinus node dysfunction and risk of incident atrial fibrillation, a randomized trial. This was published in the European Heart Journal on October 21, 2023, and the first author is Mads Brix Kronborg, a Danish cardiologist. In observational studies, high percentages of atrial pacing have been associated with an increased risk of atrial fibrillation. This study is aimed at evaluating whether atrial pacing minimization in patients with sinus node dysfunction reduces the incidence of atrial fibrillation. DANPACE II has shed light on the effectiveness of pacing in patients with sinus node dysfunction. This dysfunction affects the heart's natural pacemaker, leading to an irregular heartbeat. Traditionally, pacemakers have been used to regulate this rhythm. Still, DANPACE II specifically delves into the impact of atrial pacing, a type of pacing targeting the upper chambers of the heart. The study involved over 500 patients with sinus node dysfunction, randomly assigned to receive pacemakers programmed at a lower or higher base rate. The researchers tracked the occurrence of atrial fibrillation, a common complication in these patients, over 2 years. The proportion of patients who had an atrial fibrillation episode lasting more than 6 minutes detected during follow-up was 46% regardless of whether their devices were programmed to a base rate of 40 beats per minute, without rate-adaptive pacing, or a base rate of 60 beats per minute, with rate-adaptive pacing. The results were surprising. Despite significant differences in atrial pacing levels between the groups, the incidence of atrial fibrillation remained essentially the same. This suggests that minimizing atrial pacing doesn't offer any protective benefit against atrial fibrillation in sinus node dysfunction patients. However, the lower pacing rate group did experience a higher frequency of presyncope and syncope, indicating dizziness or fainting episodes. This highlights a potential safety concern associated with overly aggressive atrial pacing minimization. Furthermore, the study revealed that many patients initially assigned to the lower pacing rate eventually needed their devices reprogrammed to a higher rate due to various issues like chronotropic incompetence, a condition affecting the heart's ability to adjust its rate appropriately. This finding underscores the need for further research to determine the optimal pacing rate for these patients. While minimizing atrial pacing might not directly prevent AF, finding the right balance between preventing atrial fibrillation and ensuring adequate heart rate seems crucial. This contributes to understanding pacing strategies in sinus node dysfunction. DANPACE II provides valuable evidence against routinely minimizing atrial pacing in these patients. However, there is a need for further studies to identify specific patient groups who might benefit from such an approach and to determine the optimal pacing rate for the broader population. In conclusion, DANPACE II offers valuable insights into the complex relationship between atrial pacing and atrial fibrillation in sinus node dysfunction patients. While it debunks the notion of minimizing atrial pacing as a universal preventive measure against atrial fibrillation, it also emphasizes the importance of personalized pacing strategies and further research to optimize care for this patient population.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.